All right. So we're back live now with Dr. Quimby. Dr. Quimby is an infectious disease expert with CHI Health, Creighton. So welcome, Dr. Quimby. Thank you for being here with us today.
Hey, thanks for having me.
All right, so we've got a lot of questions coming in and some that were submitted earlier. So let's go ahead and get started. First question, what are we seeing in our hospitals and in this region? You know, number of cases, severity, etc.
Our CHI network is 12, 14 hospitals in the area. And at any given time recently, we're at a few dozen inpatients with COVID-19. You hear about thousands of people infected or multiple hundreds per day, but most of them are not sick enough to be inside the hospital.
Okay. All right. Next question. What's the importance of mask wearing and when is it absolutely necessary?
Dr. V was mentioning that in her video just now. The importance is to help prevent spread of infection. And a good guideline as a time to wear a mask is if you're indoors and not entirely by yourself. I'm indoors, I'm not entirely by myself, but I don't have a mask on now. That's so the microphone can pick up better and there is nobody within 6 or 8 feet of me, although you can't see that.
But I can see over here. All right, that's helpful, that's helpful. Next question. Spacing of student desks in the classroom, managing movement in the classroom. Do we keep the doors open or closed? How could you speak to some of those, or what could you speak to some of those questions regarding the classroom management of spacing?
It's been a while since I was in school, although my kids go there now. There is no way you're going to have all desks 6 feet apart and have more than a handful of kids in each room. So based on your environment, you can spread them out the best possible, which is why masking is important for people who can't distance. Door open or closed is probably not going to make much difference overall. The ideal thing for a classroom is to have what spacing you can. So 2 people sitting right next to each other at one table is not as optimal as separate desks.
All right. All right, next question. How often are we supposed to wash our hands and opposed to using hand sanitizer? Will we be able to eat in teachers' lounges and use commercial appliances in the lounge, such as an ice maker, coffee maker, toaster, etc.?
Overall, there's not a large amount of difference between washing your hands and hand sanitizer. Depending what hand sanitizer you're using and the additives in there, sometimes you can get like that lotiony gunk up feeling that a good hand wash can take care of. For teachers' lounges and that kind of environment, I can tell you that most of the breakdowns that have occurred in hospital and clinic settings were not in patient care areas. It was in break rooms and lunch rooms because people are pretty good at wearing their mask while they're doing their actual job and out and dealing with patients, but then they go to eat their lunch and they're sitting right next to their coworker who might not be having symptoms, but tomorrow will have a scratchy throat. So ideally, if you are in an environment where you're eating or drinking, you want to distance from people if you can.
Okay, great. All right, next question. Is it safe to open schools?
You will get many answers to that question depending on who you ask.
True.
We don't have information in this country yet, so we can look overseas. Israel opened up schools without any sort of real precautions and opened up a lot of community activities at the same time and had a huge increase in COVID-19 activity. Norway, Finland, and Germany opened up schools with good precautions and good community precautions, and they have not had an increase in COVID-19 activity. So based on those 4 countries, which admittedly people in those countries might be more willing to follow guidelines than in our nation, it seems that there might not be an increase in activity when schools open.
All right. Let's see, next question. Should we sanitize after each use of materials? And what is the best way to sanitize, or with what?
There is a lot of information about sanitizing and closing for deep cleaning and that kind of thing. The virus does not transmit by hands. In order to get infected, it has to hit a mucous membrane, which is the inside of your nose, your eyes, or your mouth. however it's getting there, by droplet or from the most common vector, your hand. So say this pen was dropped by somebody and they are horribly sick, and this thing is just teeming with viruses. If I go like this and touch the pen, I am not going to infect myself unless I later, before I wash my hands, rub my eyes or nose. So more important than sanitizing the environment is your own hands. That's first thing. But these are schools. These are small children or not so small children. And these are well-known vectors for various infectious pathogens. So any sort of environmental cleaning would be all kinds of good and helpful.
All right, great information. All right, is it okay to use disinfectant spray on reusable cloth masks rather than wash them? And how often should we replace masks throughout the school day? How often should masks be reused and washed? So there's 3 questions now.
Okay. I would lean toward washing it rather than using disinfectant because there is not a lot of data about prolonged inhale exposure to various disinfectants, but probably doesn't smell very good, and then you're less likely to wear a mask. At work, I wear the same mask all day long without a problem. So I don't think you need to change it after 2 hours unless it's become soiled, wet with something where there's a physical issue with it. If you are using a cloth reusable mask, it's reasonable to wash it at the end of the day. Can you go a couple days between washings it? Sure. There is concern about I'm breathing in all these germs, but they're your own germs. So you're not introducing anything else new to you by breathing on the inside of your mask, unless you're sharing a mask with somebody, which we'll call that plan B.
All right, great. Next question. What happens when a student in your class gets COVID? If you are a coworker, or if your coworker gets COVID, if someone in class tests positive, who all has to quarantine?
That will be at the discretion of the rules by the individual school districts. I can say the most important thing that each of us can do is just keep an eye on your own symptoms. If you have symptoms, don't go to work. If you're it's just allergies, but it's a little worse than normal. It might not be allergies. So you have to keep an eye on your own health and try not to expose other people if you are already sick.
Great information. All right, next question. How do we partner in small group with students?
If you're working in a small group, it's impossible to social distance, which is where masking takes the place of social distancing, my mistake. I am aware that some school districts are not having a mandatory masking policy. So if there are students who are not wearing masks, it might be safer for them to do more solo activities than in a small group because they're not able to have that extra barrier of protection there. So ideally, the fewer people in a group possible, and if you are in a small group, I would think masking is very important there.
All right. Next question. How far should children's desks be spaced to be safe? Can students exercise with distance?
Spacing depends on your environment. The more you can get, the better. It depends on each individual classroom and how many kids there are. Exercising, if you're exercising, it's very difficult to do strong aerobic exercise wearing a mask. Not because it's impeding oxygen flow or anything, but even just the forceful inhales during strenuous exercise can kind of pouch the mask inside your mouth a little bit. Exercise out of doors, weather permitting, with no mask on should be okay, especially if kids are separated. If out of doors is not possible and it's a very large gym area where they can be separated, lack of masking should be okay in that area.
All right. Next question. How do I function with the threats of infection spreading in my classroom?
That's a difficult question. There is a lot of stress with this, and the education community is facing now what healthcare community faced in March and what a lot of people in the service industry were facing in March and April. I can say you can just look at things that have happened in the last few months in service industry exposures, and hospital and clinic exposures, and we've learned some, so we know better what to do now than we did back then. The best that you can do is just realize that you do what you can to protect yourself. You keep an eye out for any symptoms. And from what we know, following proper precautions, there should be fairly small risk of transmission, like mentioned in Dr. B's segment at the haircut salon.
All right. Next question. We got a few more questions. If plexiglass is used on two sides of a desk, can a student remove their mask?
I would say no, because they're not in an enclosed cubicle. So there's not real separation there.
Gotcha. All right. This next question I actually struggle with sometimes in the clinic. How to wear a mask with glasses in a way that prevents fogging?
Okay, I have two words for that. Good luck. You get used to it a little bit after a while. And also, if you have a good metal strip in the top and you pinch down here, that can help prevent it. A lot of cloth masks aren't necessarily having the metal strip in there, so try to find one that does to help it form against your nose.
All right, that's great feedback. All right, last question. What is the recommended age that children need to wear a mask? Can children share toys and play together, or do they need to keep 6 feet apart? Should we sanitize after each use of materials? And what's the best way to sanitize?
For kids' ages, basically if they're in school, kindergarten or above, they should be old enough to be able to wear a mask. There are a few health conditions that would permit that, and they would have to be able to remove the mask themselves if there were an emergency of some sort. So that's the age. As to sharing toys and sanitizing toys, really hand hygiene is more important than that. But if it's a hard surface that's communal, every so often, like in clinic countertops, we wipe them down every hour or so at least. So if it's between class periods, might be a decent time to do that.
This one has to deal with sanitizing toys between children's usage. Do we need to sanitize between each child that uses a toy?
That might be a little bit difficult. I am by no means a pediatrician or anything. However, the kids of the age group that tend to use toys are often of the kids of the age group that are not the best at following directions. And they might be sharing a toy at the same time, which makes it difficult to clean between them. So I would just say try to do the best you can. If there's a set playtime, at the end of playtime, clean everything up. I mean, a lot of this stuff is uncharted waters. We are not certain, and it's do the best you can and figure out what works. I think it's not really realistic to hover over everybody, and before Johnny hands the block to Jane, you snatch it away and wipe it down.
Sure, absolutely. You know, one thing just hearing you answer that question brings to mind, you know, accountability with that, with staff or teachers. You know, sometimes it might be helpful to have a log of, hey, this is how frequent we're sanitizing and things like that, so we know that it's being done. Could be also another suggestion. A next question that's coming: do teachers who see different classrooms of students back to back need to do anything specific to reduce the risk of transmission between groups of students?
I would say just be very good about following the rules about masking and distancing. That should be effective no matter how many people you are seeing.
All right, great. Next question. Can teachers or counselors remove masks if working behind a plexiglass shield and standing at least 6 feet away from students?
We ran into some of this in our clinics where when we had our universal masking policy, it was said that in certain environments, if you're not around other people, you do not necessarily need to wear a mask. And what we found is that people who were in said environments, it's not actually as isolated as you think it is, because people are coming in and out. If you are in like a private office by yourself where nobody else is coming ever within 6 feet of you, it might be safe, but that is more often the exception than what actually happens.
All right. Next question. Do shields take the place of masks?
Shields might be helpful for people who can't use a mask for whatever reason, but they are not actually catching and grabbing droplets. It might just be preventing you from spreading them out, but there is still air circulation, so maybe downward. It's probably better than nothing, but a mask would probably be preferred.
Great. Should we remove clothes and shoes when coming home after teaching?
You cannot even find two docs working in a hospital agree if they have to change their clothes or not when they get home from the hospital dealing with people with known infections. If standard laundry seems to be okay, it does not seem to be a problem. If you have extra concern, then maybe. But again, this goes by mucous membranes and lungs. So unless you're in the habit of like bringing your shoes up and sniffing them or rubbing your dirty clothes over your face, your risk of catching something from your shirt is probably small.
All right.
Sorry.
Got some opportunities there. All right. So next question. If droplets are emitted into the classroom, how long will they stay active? Will filtering systems remove these?
And here's more points of disagreement from what you're finding. You have some aerosol scientists in saying one thing, certain epidemiologists suggesting another. True tiny aerosol droplets can stay suspended for a very long time. Whether that carries an infectious dose of virus in general is a matter for debate. Filtration systems can help, except you need pretty heavy duty HEPA type filtration to get lots of droplets out of the air. And even in a standard operating room in the hospital, which is pretty much the best air filtration system you can get, it takes well over 10 minutes to do enough air exchanges to clean it out. So in a standard home or school, a little portable HEPA filter is probably not going to do all that much.
All right. Okay, next question. I'm a teacher, a reading specialist who works with kids every day, or excuse me, from every class throughout the day. Do you have a recommendation on whether it is better for a teacher to travel to each classroom to work with their kids, or work in a hallway or another classroom, or have the kids come to their classroom, the teacher's classroom, where they can clean between each group of students?
I would say this probably depends how many students you're working with, because if, say you're working with 25 students at a time, having all of those 25 students traipse along the hallway to get into another classroom might not be as good as one person moving along, because you have more people passing each other. If you're dealing with, say, one or two children at a time for intensive reading help, then the fewer people around, the better. But I mean, that's basically, you would have to know more about the individual circumstances.
All right, great. Next question. If you boil a mask in water, is that sufficient to clean the mask?
That would work. I would have concerns about the life of the elastic of the mask, because it's nice to have a sterile mask, but if the elastic is shot so it no longer fits your face, it is not going to do you any good. For the cloth masks, a standard laundry run seems to be okay. If you are doing anything other than that, and I've seen the whole internet things with Instapots and microwaves and what have you, I would just make sure the elastic is still functional so that it is not too droopy on your face. And if it does have a metal insert over the nose, I wouldn't put it in the microwave.
Okay, yeah, well, yeah.
Hey.
That's another safety concern. Okay, next question, sorry. When you take off your mask, what's the best way to store it?
I have been using this since March.
Is that Tupperware?
In fact, is it a Tupperware? I don't know what brand it is. It is a Rubbermaid. So technically not Tupperware.
Okay.
And I put my little mask in there, and it's there ready for the next go with my little ear things on the inside so that it's not touching the front of the mask. I am not getting paid to sponsor any stores or anything like that, but I can say I got a package of 7 of these devices from one major nationwide retailer for about $3.50.
Sweet. All right. Next question. So as long as kids and teachers have masks on, they should be able to collaborate closely, correct? For example, in a secondary science class, there's a lot of collaboration and small group discussion or discourse.
Again, dealing with an unknown, and you find people are harping on what is felt to be best information at the time that turns out not to be correct, and then saying, well, we can't believe anything that's been said. Okay, so all caveats aside, this is just best information known at the time. Ideally, farther apart is better than close together. If close together is required, for example, you mentioned science classes like frog dissections.
Sure.
Okay,
Labs.
there's not a frog for everybody. Masking is better than not masking. So it is safer than not masking. Ideally, everybody would be 30 feet from each other. That's not feasible in a functional world. Okay. But I have, in the best environments that we have information on, are hospitals and clinics, and people working closely together in those environments, if they're following masking protocols, do not seem to spread virus very, very much at all.
Got it. All right. Next question. If a child tests positive for the virus, should all their siblings of that related to that child be quarantined as well?
That you need to follow the directions of the health department at the time. They have their rules about what's quarantine is recommended, what is not. And for example, not all siblings live together. So if you have 2 brothers who are in different households for whatever reason, just because they're siblings does not mean that they've had exposure to each other.
Great. Next question. What happens when somebody on the football team or any other sports teams becomes positive?
That would be, again, not to punt everything off, football, not to punt everything off, but health department. There are rules for who gets tested, that kind of information. I would say if you have known exposure to somebody who has tested positive, that you keep a close eye on yourself for any symptoms and not brush off any new symptoms as just, it's nothing.
Okay. All right, next question. If the kids clean hands first, is it okay to use laptops, tablets, or supplies that are usually shared in the classroom?
I mean, there's no reasonable classroom where you're not going to be sharing supplies. So ideally, you would want to clean hands before the community material use, and then afterward as well.
Okay, great. Next question. Can you speak a little bit to prevention protocols, such as using vitamins or supplements to help ward off the virus, such as vitamin D, zinc, vitamin C, melatonin?
There are various bits of information out there. A lot of them are not based a lot in science, or not a lot of good data. It has been mentioned that they found an association where populations who were lower in vitamin D might have had more COVID activity than populations who are not low in vitamin D. But there could be various things causing that, such as more people being tested, less healthy populations in general, that kind of issue. Vitamin D is known to play a role in the immune system. There are some studies ongoing if vitamin D supplementation would help those who are severely sick with COVID. I'm just picking that as an example out of one of the ones you listed. So the best that can probably be done is keep yourself as healthy as possible. That means good physical activity, healthy diet, make sure you're not deficient in anything. If you have something like diabetes, good blood sugar control, all of those things can probably help more than taking a zinc supplement, just a generally healthier lifestyle.
It sounds like basic fundamentals. All right, here, this next question, and this is something actually that I think it applies to me as well now that I'm reading it. I have a sore, scratchy throat since the beginning of March. Um, well, seasonal allergies. You know, here in Nebraska, we are bombarded by that. We live with that all year round, it seems like. And whether you're in the rural areas or in the urban areas, it's seasonal allergies. How do I tell the difference between a normal scratchy throat and a COVID scratchy throat? If I were to stay home each time I had a scratchy or sore throat, I'd never be at work.
Okay. I have personal experience with this as well. I am allergic to our pet ferret. Okay. So there is often some sort of symptoms that I will have on an ongoing basis. And the best that I can say is honestly, just be honest with yourself. In the cases that we've seen for people working in hospitals or clinic who attributed their symptoms to allergies and then it ended up not being allergies, looking back, they say, well, yeah, it was actually a little bit different than my normal, but I just didn't think much of it. So if it is your true normal, that's one thing. If it's worse than your true normal, you might want to take some extra precautions there and get checked out.
How would a fever apply to that? Like if they had scratchy,
Okay.
you know, because there's drainage and stuff with your allergies, and how would that apply?
Allergies never give you fever. If
Right.
you have a fever, you best not be blaming allergies.
Right.
On the other hand, though, not everybody with coronavirus infection will have a fever. So lack of a fever doesn't mean you aren't actually infected.
Okay. Great. All right. Next question. Dr. V mentioned in the video about 6 feet distancing. Is that the same distance for children and students? Or this person said, I heard it would be 3 to 6 feet for children.
I've heard some stuff like that too. And again, I'm going to preface this with the dealing with new unknown situation. They have found that kids under the age of 10 seem to not transmit the virus as readily as kids older than the age of 10. Not quite sure why. People have come up with reasons that might or might not be true, like they're short. Okay. So if you're short, anything that you're putting forth is less likely to get in the air of people taller than you. Okay. It could be something like less lung volumes with each individual breath. So given that it's not clear, I would lean toward the 6 feet because we know that that tends to be okay. And if it means you're a little bit farther apart, you're a little bit farther apart.
Great. All right. Next question. Is it safe for students to take off their masks while they're sitting at their desks?
Just like the adults, people are often not as far apart as they think they are. And unless your environment is such that every desk is 6 feet from another desk, that's probably not the best of ideas.
All right. This next question is for me. How to address those students who feel they are suffocating in their mask. We cannot send them outside unattended, mentally and physically. You know, I think from my perspective, it would be just providing that child the why behind why they're wearing their mask, number one, to help them understand why they're wearing it. And if they're starting to feel like they're suffocating, give them a break. Have them step out or step to the side of the classroom to make a quick adjustment. I don't know if that's would be applicable, but within the 6 feet distancing, there's got to be some, children oftentimes are fidgeting and, they're touching their face and things like that and trying to just, remind them of the why behind what they're doing. Would you have anything to add to that, Dr. Quimby?
Kids, not my forte. I have 2 of them and they're teenagers now, so I'm happy I'm not dealing with little ones. But if they truly need a break, I mean, kids do take breaks to use the restroom. At least They did when I was in school. So might be time for a little brief break for them. And really, if it's feeling like they're suffocating, that's often because they're not used to it, and more exposure might help with time on that.
True. Even in clinic, I see, my primary population for treatment is child adolescent. And I would say that the kids who come in for the in-person visits are very compliant. They're wearing their masks. They oftentimes have cloth masks that are, have some type of, design or preference on them that they're, actually think it's kind of cool. So I think you'll find that they're more compliant than you anticipate that they would be. So, all right, next question. Would using air purifiers in the classroom without windows be helpful?
Honestly, they are probably not going to do enough air exchanges with the commercially available ones to make that big a difference compared to the central air system. So it wouldn't hurt, but I wouldn't put a lot of stock in it helping.
Okay. All right, next question. UNMC has warned against opening schools as of yesterday. What is CHI Health's take on this?
Okay. First, I would like to say that I am not speaking for CHI Health. I am speaking for David Quimby. I would like to look at the data available before making recommendations such as opening schools or not opening schools. We have nations that have been able to open schools so far without increase of activity. I think it's reasonable, given the social benefits of in-person learning, to attempt opening schools as long as people are willing to look at disease activity, and if it starts to increase, have a backup plan. A blanket, this is not safe, I don't think is the way to go. We also have to keep in mind that our country is very large, and what is right in one part of our country might not be right in another part of the country. For example, along the Rio Grande River in Texas, that area is having a lot of difficulty right now. Their plans should probably be different than counties in rural South Dakota that have not seen a case yet.
Great feedback. All right, next question. Our district is requiring mask breaks during the day and have suggested to have them in the classroom. Spread them out and no talking. If you've been in an elementary school classroom, this would be difficult, and I don't feel like this is safe. Should all mask breaks be taken outside?
Ideally, mask breaks would be outside or in a very large area, perhaps larger than a classroom because of the distancing possible in a classroom, but it depends how many people are actually in the classroom. I believe Omaha School District is going to have only half of the students there anytime, so spacing might be possible. Outside, whenever you're not wearing a mask, is better than inside, but distancing as appropriate should help out.
Okay. Next question. How safe is it to teach middle school PE with 4 teachers in an elementary sized gym, classes up to 20 students, so 80 students in a gym with students not required to wear a mask? That's a detailed question. Even if a teacher has on a mask, is it safe for the students or for the teachers to teach a middle school PE with the teachers in an elementary sized gym where you have 80 students in a gym and students not required to wear masks? What is my risk? Go ahead, sorry.
Oh, no, sorry. If the gym is the standard size that I am remembering, I think it might be a little bit difficult to have 80 students in there and have them distanced appropriately. I do not know if individual schools or the districts are coming up with ideas about this, like maybe have more of the PE classes out of doors or cut back on certain PE classes to other activities. That might depend on the individual place. 80 people in a small confined place is not masked is probably not the safest of ideas. We see outbreaks occurring even with, say, 40 people in a church where you can end up with people transmitting to each other. So 80 unmasked people in a gym might not be the best way to go, but I don't know what the circumstances are at individual schools.
Great. There's a second part of that person's question. What is my risk as a teacher? We've got 6 45-minute classes a day, up to 120 students in my class, 480 students passing through the gym with 4 teachers. What is my risk as a teacher?
You can't really put a number on something like this. It really depends on the activities going on. if your classes are outside, it would be less than if they are having 80 unmasked people in a gym. So without knowing circumstances, it's tough to put a number on that. If the plan is to have 80 people unmasked at a time in a gym, again, this is one person speaking, that plan might want to be revisited for safety reasons.
Mm-hmm. All right. Next question. How do I safely pass papers to students or collect papers from students?
Just do it. The most important thing is not touching your face. Okay,
Great.
we ran into issues. This came up months ago in the hospitals with people who were transferring between hospitals, and there were medical records that would go along with the patient. And do we need to leave the chart alone untouched for so many days before we touch it? And nothing ever really turned out from that, any evidence of transmission from patient charts or anything like that. Just wash your hands.
Okay. We have time for 2 more questions. Should we wash our masks every day after we return home from teaching?
It wouldn't hurt. If you have enough masks that you can do that, you can just put it in the laundry with the rest of your clothes.
All right. Last question. I'm teaching K-8 music where our instruments need to be sanitized between uses. I don't want the younger kids to help sanitize, but could older kids help sanitize before the end of class? What age would be okay to help sanitize?
I'm going to get in trouble for this if I'm not already. Okay, I don't think there's a set age cutoff for anything. It depends on how well the children are doing it. For example, I have a 13-year-old at my house who can't manage to pick up socks. So that would be a problem. If you can try and see how the kids do it and watch them the first few times. If they are able to do it, then it doesn't really matter what their age is, because kids have different levels of emotional maturity that are different than their calendar age. So it's basically watch them, and if they can do it, then you can trust them going forward.